My name is Tierney Sears. This is my Nursing 390 education. I will be presenting choices and alternate lifestyles that can be taken after a heart attack. This is Wendy. She is going to be my audience for the education. She has had a heart attack in the past, so she's an appropriate audience for this education. She has a modified copy of the handout for her. It's got larger print on it so that she can see. And we're also going to review the PowerPoint and go over the education. The need for this education was specified through your questions and concerns of what you should be doing when you go home after your heart attack. Let's see. The language that we're going to use in the education has been switched to plain language, so there's not any medical jargon or anything that you wouldn't be able to understand. And a family member that's going to help you at home has also been given the same papers and the same PowerPoint to go over. That way, at home, the nurse will be replaced with this role model so that any questions or any concerns that you have, they can assist you and give positive reinforcement. The learning theory that we're going to be using in this education is a social learning theory. So reinforcement will be made through a role model. The motivations that you will have for this education are what you think would be good or bad, and also the views of society and the reaction of I would give or your family member would give for the behaviors that you have. And as a role model, I'm going to show you, and when you go home, your family will show you the appropriate behaviors that would encourage a positive response. The learning objectives for this education are that you'll be able to discuss changes that you need to make at home to make a heart-healthy lifestyle. You'll be able to pick out and discuss foods that are part of a heart-healthy diet and then pick out ones that are not. And you'll also be able to discuss the importance of smoking cessation as it's related to your heart health. After a heart attack in the hospital setting, the education that you have been provided will start on admission, and it will also be given to your family, and it will be revisited and reinforced throughout your hospital stay to make sure that you have an adequate understanding of changes that you should make to promote a heart-healthy lifestyle. The following changes are what you should be able to kind of identify and apply to your life so that changes can be made. You need to understand the importance of medical management, including the medications that you're going to go home on, the importance of those medications and how they play to your health, as well as follow-up appointments that are to be made with your physician once you leave the hospital. You'll also need to make sure that you understand specific activity restrictions for immediately after your recovery period, which is usually about 4 to 6 weeks. The need for a regular exercise routine and physical activity once you go home to keep your heart strong. You'll also talk about decreasing your stress and lowering your cholesterol to promote health. And you should also be aware that controlling other diseases that you might have, such as diabetes and hypertension, can also affect your health and can promote the reoccurrence of a heart attack in that situation. You should also after we finish the education, be able to identify some signs and symptoms that indicate that a heart attack might occur again and what you should do in that situation. Signs and symptoms that you may or may not have experienced before that could recur with a heart attack are chest discomfort that feel like tightness, pressure, fullness, or squeezing. They may be consistent or they may come and go over a period of time. You can have pain that radiates in one arm, usually your left arm, in the upper back, neck, or jaw. Stomach pain that can be comparable or considerable to heartburn, as well as shortness of breath, anxiety, lightheadedness, or sweating, along with nausea and vomiting. In the case that any of those occur, you should go back to the hospital or call an ambulance. With a heart-healthy diet, one of the major things that you need to start doing is controlling your portion size, eating more fruits and vegetables, limiting unhealthy fats that have been present in your diet, decrease the amount of fried foods and replace those with baked and grilled items. Reduce the amount of food or salt that you use in food, and you can even replace it with different spices or with salt substitutes. And you're also going to decrease the amount of sugars and caffeines that are present in your diet. Some of the top healthy foods that you can eat to promote heart health are salmon, oatmeals, almonds and walnuts, tuna, brown rice, spinach, broccoli, tomatoes, blueberries, oranges, dark chocolate specifically, teas, and cantaloupes. Foods that are pretty obvious that you want to avoid are donuts, french fries, soda, ice cream, various processed cheese, potato chips, candies, cakes and pastries, bagels, and other types of chocolate that are not specifically dark chocolates. Smoking cessation is something that in the hospital we start on admission. You should be able to understand and have a plan in place for smoking cessation while you're in the hospital as well as when you go home. The biggest thing that you need to remember is that living a smoke-free life will not occur overnight. If you've been a smoker for many years, it's going to take a lot of effort and it's going to take a lot of time for you to kind of slow down and kind of break that habit. You should understand the reasons why smoking is bad for your heart and not just your lungs. Many people just think that smoking is just bad for your lungs. They don't understand the correlation that it plays on your heart. When you smoke, it decreases the oxygen that you get to your heart. It's also going to increase your blood pressure, and it's going to damage the cells that line your heart and arteries, and it's going to kill them quicker. Ways that you can promote a smoke-free lifestyle is not to carry a lighter, matches, or cigarettes with you. If you have any of those things at home, get rid of them or give them to someone else. Work with doctors to find medications like patches and gums that can work while you're in the hospital as well as when you go home. That way, when you go home, many of these medications are available over the counter. Also, if you work with your doctor to find these medications, it's going to be easier to make sure that they don't interact with any of your other medications and you know how to properly use them at home. You can identify various times or situations that may make you want to smoke more and avoid those situations or find other tasks that occupy your attention or time. And the biggest thing is that other family members or friends that you have that smoke in their home or in your home, you need to encourage them to either quit with you or ask that they not smoke around you or go outside to smoke because it's going to decrease the temptation that you have to smoke. Resources are very, very important when you leave the hospital. That way, you still have a support system in the hospital that you do when you go home. A cardiac rehab program has been put in your paperwork and given to you for when you go home. That way you have resources that you can use from there once you go home to promote all of these different teachings. There are various different resources that are available in the community. You have Stop